Staying home has been particularly hard on older people and others at high risk for contracting the coronavirus. With more places reopening, many seniors are now wondering if it's safe to resume some of their normal routines, like visiting with their grandchildren. Karen Drew checked in with the experts.
There's not a magic age at which your risk is higher or like too high, but all of us need to consider what kind of risk is acceptable.
Dr. Preeti Malani is U of M's chief health officer. She's also an expert in infectious disease and geriatrics. She says it's important for everyone to look for ways to re-engage in less risky ways.
With all activity, it's about decreasing risk to the lowest possible risk. We can't eliminate risk short of just staying home and never going outside, and that is also not a good option for most of us.
That means going grocery shopping when it's the least crowded, or sticking to delivery services if it's still too high risk. Doctor's appointments are essential, and Malani encourages everyone to reschedule canceled appointments. As for seeing the grandkids,
this is a question that a lot of people have, and there's not a perfect time and there's not a way to do it without any risk. But right now in Michigan, our numbers are pretty good. And if people have all been staying home and doing a good job of maintaining social distance, the risk is acceptable to go and visit with your grandkids. Be outdoors, and that is always going to be a safer option than being indoors. Washing your hands, and certainly if anyone has any symptoms, they shouldn't be interacting with anyone else. They should be staying home, and if those symptoms worsen, they'll be tested.
Dr. Malani recommends having a discussion as a family to figure out the best approach before you visit. If you're in a higher risk group because of health problems, you should also consider talking to your doctor first. If you're depending on hand sanitizer to keep you safe from the coronavirus, keep an eye on the clock. According to the CDC, rubbing in hand sanitizer for anything less than 30 seconds can leave traces of active virus on your hands. 30 seconds exactly is enough to kill COVID-19. That's about how long it takes to sing happy birthday 3 times. The CDC also recommends using a sanitizer with an alcohol content of 70% or more.